All right, hello out there. It's Dr. Renita and Dr. Price.
Hello.
Thank you for joining us today for the Hour of Breakthrough. We're going to be getting started shortly, but I wanted to first tell you a little bit about the Hour of Breakthrough for those of you who are joining us for the first time. The Hour of Breakthrough is a monthly segment, or mostly monthly segment, that I do talking about issues of mental health that affect our community. And it's really an informative segment that's done via Facebook Live. I have guests that are experts in the field and that can provide information on mental health topics. Today we're going to be talking about women's inner fitness. And so I have Dr. Renita Price joining us, licensed psychologist, and she's going to talk to you more about what she does, what her expertise is, and what women's inner fitness is, what we mean when we say that. I look forward to this time together. I hope that you guys will find it very informative and helpful. Also, this is Mental Health Awareness Month,
Yes,
isn't it?
it is, yes.
So, good way to sort of conclude the month talking about women's inner fitness and how that relates to mental health. But I think that you will enjoy this segment. So let's get started. Okay, so Dr. Renita Price, can you tell us a little bit about your work, the populations you serve, and sort of what you do as a licensed psychologist?
Okay, so my area in being a psychologist is working primarily with women. Mm-hmm. So at our practice, what we do is we try and serve women in allowing them to have a safe place where their voices can be heard, and where they can bring very sensitive situations and have them discussed with other women who may be able to better help them to gain perspective or to work through whatever it is that they're experiencing. So my particular area is women diagnosed with cancer and female veterans.
Oh, wow.
And each one of those particular populations have similarities as well as differences that they experience from a mental health point of view.
Wow. Dr. Price, do you mind if I ask you how you got involved with working with those two populations, if you don't mind sharing with us?
Yeah, sure. I'll be happy to share with you. So breast cancer and cancer awareness is something very near and dear to my heart, because in the first year of my master's program, I learned that my paternal grandmother had stage 4 breast cancer.
Oh, wow.
Now, for people who know about cancer, you know that there are stages, and so it goes from stage 0 to stage 4. So the higher the number, or higher the stage, the more aggressive and that the cancer has become.
Yeah.
So she was at a stage 4, and she had actually been diagnosed years earlier, but had opted not to get treatment.
Okay.
And so, as with many people from her generation, and particularly women who have strong spirituality and faith, that's what she relied on. Now, it had a significant role, and there is research to support that prayer and meditation can be very helpful for people who have chronic illnesses. And for people who have heart disease, it's shown very good results as far as positive outcomes and prognosis. So that was her way of self-treating. And so when I learned this in my master's program, I was I became very interested in like the psychosocial role in spirituality and chronic illness. So I actually flew to California and talked to her about, one, why didn't you get treatment? But two, how did this sustain you this long? Because she went through every stage in order to get to stage 4, and she was still doing most of the activities that she had always done. So this is why the family did not know she had breast cancer. Because there was very few things that she was no longer doing. So I became very interested in the spiritual, psychological, social, emotional piece of women who have been diagnosed, and learned a lot from her as well as through research. So I did my dissertation looking at spirituality and the psychological well-being of women with breast cancer. So that's how that became part of my focus.
Wonderful.
And so I'm at Purdue and I'm doing this, and then I got introduced to a visiting professor who said to me, well, when it's time to do internship, have you considered the military? And I said, I like makeup and hair too much. Like, how am I going to go into the military? And he said, no, it would be a very good thing to consider because the military has so many different rotations. You see children, and you see, of course, the service members. There are inpatient, outpatient, and there are various rotations. And he said, you should take a look at it. So I took a look at it and found that, yes, there was so much that could be gained from doing an internship in the military. So since my father, his father, and his father were all in the Army, if you're counting that's 3 generations, there was no, there was no consideration of any other branch but the Army. So I'm 4th generation Army. I went in and I did my year of residency, they call it residency in the Army, internship in clinical psychology. And got a very fantastic internship experience with all those things I just said. Outpatient and inpatient, and oftentimes, from internship, it's typically one or the other. But in the military setting, we had exposure to both. And then the service members, of course, are 18 and older, but they have their family members. So we also had opportunities to work with their family members and look at the impact of the things that the soldier is going through on the family, and then also, of course, vice versa. And then how the military supports and takes care of the military soldier, and so on and so forth. So that's how I became very interested in veterans and breast cancer.
Very interesting. You mentioned earlier that there are similarities between the two populations. Can you just maybe share one way that, or one thing that you've seen that's sort of similar?
Yeah, the biggest thing is PTSD. There is more research that's coming out now about women who have been diagnosed with cancer. And one of the things that it talks about is about 30% of women diagnosed with cancer will also have a PTSD diagnosis. Because if you think about criteria A for PTSD, it is either, you're exposed to a traumatic event that would either cause you harm or death or something about the integrity of self. So all those different things, when a person is diagnosed with cancer, those are, some of just the initial pieces of it, just the very nature of it being cancer. They meet criteria A, and then there's the nightmares, there's the irritability, there are all the other emotional things that go along with it. So PTSD is something that is just now being looked at for women who are just people who are diagnosed with cancer. And of course, we know that for military populations, PTSD is fairly high.
I wonder if that's if that would be similar for other terminal illnesses, or sort of the PTSD part of it.
I would say yes, because in my private practice, I specialize in women who have been diagnosed with cancer, but I get a lot of women who have been diagnosed with various chronic illnesses. Autoimmune diseases. That is a very big one. More like the names escape me, but those lupus. Lupus and things along those lines. There's some pulmonary ones that really affects individuals. And it seems like there are new autoimmune diseases that are constantly being discovered and coming out. And in working with a person right now that I have with an autoimmune, just being able to put a finger and say it's actually this thing has been really difficult. With cancer, it's a little more. There's been a lot of research, so it's often often they're able to find the cancer fairly quickly. You
Yeah.
kind of get a sense of where it is in the body, and there's scans and
Right.
free radicals, and they say, okay, this is cancer.
Right.
Well, with these autoimmune diseases, so many different functions of your organs start shutting down or start underproducing, that is so hard for the doctors to pinpoint exactly which one it is. And until you can pinpoint what it is, it's hard to treat it.
Right.
So you're treating symptoms.
Right. Wow.
And so a lot of PTSD with most of those autoimmune diseases. Yeah.
Wow. That's incredible. Such important work that you're doing. And we had talked, you and I have talked before.
Yeah.
And one of the things that you had shared was that I just immediately just kind of, it stuck with me. I'm like, this woman inspires hope. With her clients. I mean, I think that we all sort of do that as therapists, but when you're talking about people who have these chronic, serious medical conditions, you're really a hope inspirer. So can you talk a little bit about, I mean, you don't have to go into a whole lot of detail, but how you would work with someone who has, cancer and may not have, that long to live?
Hope is, I'm glad that you mentioned hope.
Yeah.
Because to me, hope and faith, it's everything.
Mm-hmm.
It's everything. So I have a protocol that I put together, a little booklet, and I should have brought one with me, but I put together a little booklet, and I call it the Hope Protocol. So part of, in my Hope Protocol, it takes H, O, P, and E, and then there are some questions and some activities that it encourages the individual to do. So for hope, H can stand for humor. It also stands for higher power.
Wow.
So I encourage people to connect with their higher power and to use humor. So I encourage people to have at least 30 minutes of laughter a day.
Like that.
Find your favorite comedian.
You hear that, y'all?
It doesn't have to be Chris Rock,
Right,
but
right.
it can be a Christian comedian
There you go.
as
Nothing wrong with
well,
that.
because you're looking at your higher power. But just laughter, because laughter does so much for us. It helps decrease anxiety. It helps to increase our connections with people, and just our overall mood.
Yep.
So I love people to laugh. So in my sessions, sometimes we're laughing. We're just getting a hearty laugh. And there is a new therapy out, you may have called it laughter therapy.
Okay.
Where they're teaching people, and they're doing a lot of this work with cancer patients,
Oh, wow.
how to just laugh, and it's like a diaphragmatic laugh.
Wow,
From,
like a hearty.
yeah,
from your
really
gut.
hearty,
Yeah.
like using your all your breath and everything,
Yeah.
and it's deep breathing too at the
There
same
you
time,
go.
right? So,
Wow.
so those kinds of things, and so I use the Hope Protocol with individuals, and it really, my thoughts are always, how do I help them live as long as they're living?
Wow, that's good.
Yeah, God takes us all when He wants us.
That's right.
Don't stop until there's no more breath left.
Wow, that's so good.
So that's what I do.
I want to say it again, what you just said, how to help folks live while they're living.
Yes.
So there's a difference between living and existing?
Existing.
Or just being here?
Yeah, because oftentimes when a person is given a serious diagnosis where we're not quite sure how the outcome is going to be, we're just not sure. Many times people stop right there, they get stuck.
Yep.
And in the PTSD protocol that I use with veterans and any person who has PTSD, one of the things that we're trying to do is get them unstuck.
Right.
Because once we get people unstuck up here, then they start being able to move towards a better place, and a better emotional place.
Right.
So, yeah, trying to get them to keep living.
Yeah.
What is it that you have thought about doing that you hadn't done? Or who do you want to make sure knows that they are well loved until you aren't able to do it in person again.
Wow.
And I'm thinking about a person in particular, and she and I, we worked on this. We worked on her having a voice, because people will get very concerned for you, right? And they'll come and they're like, you should do this, this, and this, right? I'm going to help you do this, this, and this. And oftentimes we can be very grateful, and we say, okay, well, for this person, it was her daughter. Her daughter was very helpful, right? So her daughter said, Mom, I'm going to make sure that you eat better, do this, and do that. So she had it all mapped out for Mom. Mom was a feisty woman. Mom was like, no, I'm not sure. But she was grateful that, so I said, what is it that you want to do? What do you want to do? And she told me, and I said, then this is what you're going to do.
Wow.
Do that.
Wow.
And so then we role play how to say this to this very kind, beautiful soul who wants to help take care of her. That's nice, but no, I really want to do this thing over here.
Yeah.
So we role played it, and she did it.
Wow.
So she lived on her terms.
Awesome.
And she did the things that she wanted to do. And she said, when we go to the doctor, this one's talking, this one, all the people who come with me, my support, they come and they're talking. I said, what happens when you try and say anything? Well, the doctor is consumed by what they're saying. I said, well, what happened if you went in there alone? She said, that hadn't happened. I said, so why don't you write down, I would say, write down your questions, right? Put it in a composition book or whatever. Write down your questions you want to talk to the doctor about. And then ask your loved ones if they would give you just a minute, that they would stay in a waiting area just close enough to where if you need them, they're there.
Right.
But just a moment for you to have with the doctor.
Right.
She said, I'll try it. That's exactly what happened. She had her list of questions.
So good.
She and the doctor were able to talk. She didn't feel overwhelmed because her questions never get answered because all of the loved ones are talking.
Right.
So she did it on her terms. And we modeled it when she came to my office as well.
Okay.
Now, her loved ones never came in the office with me, and I'm not sure why. Probably because they knew I would love on her when she was in there, and, I wouldn't give her any bad news. But, so I said, okay, so just let them know, like, when you come see Dr. Price, they sit in the waiting area and, have some water and coffee or whatever. That's the same kind of thing that you want. You're safe in there as well.
Yeah.
And I also talked to her about that the way she walks in is the way she's walking out, except she has more information. So, so they, you have a serious diagnosis.
Yeah.
You don't know what the doctor is going to tell you. So you've got all these labs, and they're going to tell you something.
Right.
And I said to her, your limbs and everything still feel good, right?
Right.
When you walk in, when you walk out, all these things are still going to feel the same way.
Wow.
Now, the only difference is going to be you're going to have more information about what's happening in here.
Right.
So let's just look at it that way.
Wow.
And she said, okay. So I go in, I've got my questions. If it's something that is going to be hard to hear, I can either ask one of my loved ones to come in, or I can grieve with the doctor there, or I can say to myself, okay, this is more information, and now I know how I'm going to address this.
Wow.
Because I said the doctor's going to have a plan.
Right.
They don't just give you something and then not give you a plan. They're
Right.
going to tell you the news,
Right.
whatever it is, and then they're going to have a plan.
Right.
So I said, now keep that in mind. So she was able to do that.
Wow.
And every time she walked out, she said, I have more information, not what I had wanted to hear,
Right.
but
Wow.
I know that I'm walking out the way I walked in. Everything still works. The sun is still shining.
Wow.
I'm still going to go to a beautiful home, and I still can love on these loved ones.
How empowering is that for the client? Like, that's tremendously empowering, just how you've reframed things for them and helped them see things, differently. That's incredibly empowering. I think
Thank you.
you talk, it's such important work. You talk about stuck points, and a lot of times, even working with depression or other sort of mental health sort of diagnoses, we see similar things, and helping people to change perspectives, reframe challenging unhelpful cognitions. you know, it's all really important work, and so I just commend you and I thank you for what you do.
Oh, thank you.
Yeah.
I see it as a ministry.
Amen.
And once my grandmother was diagnosed, it just took me on this path of just wanting to learn more and know more. And as I was doing my dissertation, doing the reading on the spirituality and where spirituality has been used with other populations. It's been used with people who have been diagnosed with AIDS, HIV. It's been used with cancer patients. It's been used with people who have cardiovascular issues. I mean, just all sorts of ways prayer meditation has been used and has had very good results. Not always to stop whatever the illness is, but to help people in their mental state, help them to shape what life is for them and how life can continue to move forward for them until God says different.
Awesome.
And that's all I want. Keep living until God says different. I want that for us.
Yes.
I want that for people who have had other diagnoses, maybe we don't have. I want that for everyone.
Yeah, that's so good, so powerful. It's interesting. It's like there's research to back what I think. If you already have a spiritual, connection or relationship,
Absolutely.
or if you're, a believer, you already know that.
Yeah.
But it's like it's nice to see, the research supports what
Yes.
we've known from our own personal journeys and experiences. So wonderful. Yeah, I know a lot of these questions were not.
No. I mean, I'm happy to talk about this
yeah.
work. I find it so important. And from the mental health piece, when it comes to people who've been diagnosed with cancer, there's fewer clinicians who are involved in the work from the mental health side.
Yeah.
So I am vice chairman for Breast Care for Washington, which is a breast cancer awareness and mammography organization in District Ward 7, in DC, and they serve Ward 7 and 8. And a big part of what our mission is to provide care for women regardless of their ability to pay.
Wow, that's awesome.
So we want women to come in, and so from a psychological standpoint, there's a greater need than, we have so many people that we could serve, but we don't have as many people coming in. That's what I want to say. And so in trying to help people to understand how important these things are to their health, and understanding just cancer and cancer patients just within themselves, that's why a big part of my focus has gone in that direction. Because I want to be able to serve people before they get any kind of diagnosis, just encouraging them to continue to get the mammograms, and how do we get more people in to have those mammograms?
Yeah.
There's a whole psychology with it.
Yep.
But then a lot of it is fear.
Right.
Because once they get the diagnosis, then they say, then what?
Right, exactly.
Who's there with me then?
Exactly. I think people don't know. It's like, like you said, and then what? Or sometimes people think, and this is the end.
Absolutely.
This is doom and gloom.
Yes.
So
I've got to be there. I feel like I'm there to help get them in the door.
Yeah.
So that we can get more information.
Yep. I like that.
And then if they have the more information and the results are not what they would want, not what any of us would want for them, I am there to help them also on the other side of that.
Right.
To work on the treatment and be with them when they have the emotional stuff and the questions, and how do I talk to my family, what do I say to other people about this.
Wow.
And a lot of folks feel that burden.
Yeah.
A lot of women, particularly in the African American community, do not have husbands or finances in the same ways that maybe other communities do. So there's a lot more fear in getting a diagnosis.
Sure.
Take some water.
Yeah, that's fine. Just to go back to something you said, and I do want to go on to some of our other questions, but the organization that you were telling me about that works with the women from Ward 8 or gets the information out there, do you have like a website or something that you can direct people to? Or?
I do.
Okay. Can you say it so that you okay.
So it's Breast Care for Washington, D.C.
Breast Care for Washington, D.C.
DC, yes. And we have an exciting initiative that's coming up. So on Wednesday, June 12th at 10 a.m. at Breast Care for Washington, we are unveiling our mobile mammography unit.
What?
Yes.
Wow. So it's a portable.
So it's an actual portable, yes, it's a mammography unit. It's on this beautiful bus.
Wow. So it brings the mammograms to
It's going to take the
people.
mammograms to the people, yes. So that more people have access to
Awesome.
mammograms, because that's what we want. We want women in these wards, I mean, all over the world, to have access to a mammogram. And the same conditions apply, regardless of their ability to pay.
Good.
They can still get a mammogram.
Wonderful.
So, so that's happening on Wednesday, June 12th at 10 a.m.
Okay.
at Breast Care for Washington. So
Okay.
we're really excited about that, and other initiatives that are going to be coming as a result of that.
Awesome.
Yes.
All right, guys. So you hear that, right? Breast
Care for Washington, D.C.
breastcareforwashingtondc.com.
.org.
.org. Okay, so check it out. Please do. All right, that's awesome. Will you be there as well?
I'm going to be there. Yes.
So
I
you
will
can meet
definitely
Dr.
be there.
Price. All right, great. So, what are some of the mental health issues that are more common to women than men? You know, we were talking about, you know, some things, you know, certainly breast cancer, you know, I think that's more common to women. But mental health issues specifically, what are some of the mental health issues that are more common?
Well, it's interesting. Anxiety and depression, as well as eating disorders, are more diagnosed in women than in men. So I say more diagnosed because it's hard to know if we actually acquire it more frequently than men, because our manifestation of symptoms look different.
Right, that's true.
So for women, it's often more emoting and sadness. It's often because society allows us to share our emotions, then we tend to do so a lot more. For men, it might come out in anger, aggression, fighting, those kinds of things. Some people are like, wow, that dude is angry.
Right.
No, that dude might be depressed, anxious, or have PTSD.
Right.
But we don't quantify, we don't look at it the same way.
Right.
But but anxiety, depression, and eating disorders are diagnosed more in women than men. Now, I mean, our bodies are also made differently because there are many hormonal changes. Yes, that happens. And women, from, you know, starting a menses to ending menses to having a baby to other endocrine type diseases that go on in us. So there are so many ways that hormones play a role in our body and our emotions and just our makeup as women. So those things contribute to it as well.
Great. So I was going to ask why, but I think you sort of captured why. You talked about society playing a role. You also talked about just biology playing a role.
Yeah, absolutely.
Like just,
biology is just different.
So it does make a lot of sense. I wanted to ask, are there things that but prior to that, I wanted to ask you, how do we, the layperson, because a lot of people here that are watching are not mental health providers, and they, and they don't, some people may not know, how do you know when there is a mental health issue, like specifically for women, you know, because that's the primary audience out here today. How do you know when there's a mental health issue?
Well, I think the Cliff Note version is when we recognize and notice changes in ourselves, or someone else may say to us, "You seem different." I think that is a pretty significant indicator that something different is happening with us. So, you know, you and I know symptoms. And for some people, they may not recognize that they now don't want to get out and around family members and friends, that there's more social isolation. They may not notice that they're sleeping more, or you may notice insomnia, but you may not notice that you're sleeping more than you once did, like a lot more. Some people may not notice that that their focus, memory, and concentration is off, and that they're doing more of this. Now, someone else might say, to a parent, "Mom, you used to be able to remember everybody's name," and the mom is like, I'm struggling with that. They may not recognize that. They will recognize more, maybe morbid or suicidal thoughts. The individual would notice that. They may not notice the psychomotor agitation, that now they're pacing more, where someone else looking at them may recognize that. They may not notice that their leg is always shaking, or that they're having a hard time feeling relaxed, and it may come out as being easily frustrated or having a hard time just really being able to let things go, but someone else might recognize that.
Right. So would you say that changes that you or other people might notice, or
Yes.
other people that are close to you are saying, "Hey, I've noticed this," you maybe pay attention to that?
I think you pay attention to that.
Yeah.
When I'm talking to veterans, of course those who have been in combat, they rarely recognize the symptoms and behaviors that their loved ones recognize. So I'll often say to them, "What did your wife," it's usually a male, "what did your wife and kids say about you since you've returned from combat?" "Oh, they say I'm not as patient as I used to," or "I've noticed I have more road rage. I used to not have road rage." I'll say, "Tell me about, did you drive a lot while you were in combat?" "We were always in convoys." Ding, ding, ding. Right.
Wow.
So oftentimes it's harder for us to make those connections that something about us has changed, and often our loved ones will notice that.
That's good. So what do you do? You have the these changes, people are bringing them up to you, so what do you do? Should they go on to Psychology Today immediately, or what should they do?
Yeah, I think that people should reach out to, of course, I'm a mental health provider, I'm a psychologist, so I'm thinking, reach out to a psychologist. And for people who feel maybe more comfortable talking to their pastor or priest about it, make contact, but make contact with someone. Get someone to connect with whom you can talk through some of your experiences or things that have been going on in your life that's causing you. I had a professor that would say dis-ease. Dis-ease.
Get it?
Yes.
Disease, dis-ease. That's good.
Yes.
Yeah.
Something, whatever it is. And so when people come into me, I'll often say to them, "What thing keeps you up at night?" They'll say, "I don't know, there's so much going on." And I'll say, "What thing keeps you up at night?" And they'll say, the loss of a parent. Or they'll say, "I went to combat and Joe died in front of me." Whatever it is, they'll say, and then that's where the work starts.
That's good.
So if you don't know, if you're not quite sure, and it feels like your life is just, you're overwhelmed with everything, try to think of the thing that resonates. What thing keeps you up at night? And that's probably where the work starts.
That's so good. I love how you're talking practical, practical tips and strategies, because I think a lot of the times, we can talk from a very kind of tower looking down, like this is what you do, technical, psychobabble, they used to call it back in the day. But I think we need to sort of help these things and these strategies, be attainable to people and sound, realistic. And will I really do that? So even if you don't, call 1-800, dial a therapist or whatever,
right.
You could, there's someone in your life that you feel comfortable with, that you can connect with, that you can talk to. Sometimes it's, like you said, the pastor, sometimes it's a primary care person. And, sometimes those people will be your initial point of contact,
Absolutely.
but they may, refer you to therapists. So if you, there's some of, I have friends who, they all know about Psychology Today or Therapy for Black Girls, which is another website. If you don't want to go straight to a therapist just yet because you're just not sure, if it seems more natural to, to go to someone like a pastor, then definitely do that. But yeah, I love it, Dr. Price. I think it's really helpful how, you're just, talking real talk. Like that's what they say, in this day and age.
We gotta have, we
Real
gotta
talk.
have real talk.
Keep it real.
Because when we talk among each other, we talk in diagnoses and we talk in these different ways. And people will say, I don't know what that is.
Right.
I had someone just last week say to me, I don't know what anxiety really is.
Mm-hmm.
So now I have to break it down and say things to her. I said to her, do you sometimes feel like you just can't stop worrying about things?
Mm-hmm.
Do you feel like your heart is always racing really fast? Do you ever get clammy hands and a sweaty brow? Do you ever think about going into a situation and you feel your body is starting to react or change? So I said a couple things, and she said, those things do happen to me. Now I know what it is.
Wow, look at that.
Mm-hmm.
Look at that. She just needed you to sort of break it down and make it,
absolutely.
Like, oh yeah, that resonates.
Because we're talking to each other all the time. Oh, you got depression, you got anxiety, and folks are like, I don't even know what those things are.
Right. So yeah.
And people will use, depression. It's widely used.
Right.
But it doesn't always. It's not always depression. Sometimes it's adjustment disorder. Sometimes it's grief. Sometimes
exactly.
It can be a lot from our point of view. It can be a lot of things.
Right.
But when we start just breaking it down, then real people can actually say, yes, those are the things that happen to me.
Yeah, that's good. That's good. Very important. Wonderful. Okay. What are some of the barriers, from your perspective, Dr. Price, that are, sorry, yeah, we just talked about number 4. What are some of the barriers to women receiving mental health treatment in our communities, and what can be done to rectify it from your perspective? So what are some barriers to women receiving mental health treatment?
Wow, that could be its own segment. Right, because there's a lot of misunderstanding about what therapy is and who gets it. So I know that when I was coming up, that was what other people do. We go to church. Right. Like, you don't have no problem.
Right.
We go to church.
Right.
You take it to the altar, which I did that too.
Right.
But so that can sometimes be what people do instead of.
Right.
So it can be a barrier to many people, and there are a lot of folks in the church who are struggling with various mental health issues that you and I will never see.
Right.
And unfortunately, some of them, decide other methods of dealing with it. But those barriers can be that. It can also be a family, believing your family will or will not accept you going to see a mental health provider, because that's what other people do. That's not what we do. Right. There are people who are concerned about telling family business, or making a parent or somebody they love look bad.
Right.
I have a young lady, and she's telling me her stuff, and I'm just listening. I'm not even judging. I'm not judging anybody. I'm just hearing, and I'm thinking, how do I help her? That's all I want to know. How do I help her? And she'll say, stop, and she'll say, don't think bad about him. He's a good guy. I said, I'm not judging either. I'm hearing what you're sharing, because I want to help you to work through the thing. I'm not judging the person. So that comes up a lot too, is that they don't want folks to think badly of a parent or think badly of a loved one. So that's a barrier. Yeah, absolutely. But I think one of the biggest things is just not really understanding what therapy is and who it's for.
Right.
And it's for everybody.
Yep. I think, I think you hit the nail on the head. I think, culturally, I think, historically, Black people, it's like, therapy is not for us.
Yes.
And certainly if you are a believer, therapy is not for you. I think some churches are doing a better job of incorporating mental health into the church. But yeah, like there's the divides socioeconomically.
Absolutely.
Those are rich men problems, not, you don't got time to be
absolutely.
depressed.
Right, yeah.
So yeah, that certainly can serve as a barrier. And the perspective, the stigma associated with getting help for mental health. health. It's sort of like, I think a lot of women have that complex of superwoman.
Yes.
I got to be able to do it all. I'm strong. I got to be strong.
Yeah.
And, when you go to see a mental health provider, for many people that signifies you're not strong.
Absolutely. A lot of folks do think that it's considered a weakness.
A weakness, right.
And I should be able to work through that.
Right.
And I hear that a lot with women, definitely women of color.
Mm-hmm.
I'm supposed to be able to work through this. Or people will also say, these other folks have way more problems than I have.
Right, right.
I don't have their level of problems. And I say, but if it disrupts your yes, then it's a problem for you.
Right.
It doesn't have to look like that person's problem. It just has to be a problem for you.
Yeah.
And it doesn't mean you're crazy.
Right.
You're not crazy. Many people have difficulty adjusting to transition.
Right.
Deaths, emptiness, new job, change in marital status, anything.
Yep.
The birth of a child.
Yep.
It's so many transitions that happen in our lives. Moving to a new state. Yeah. And sometimes just trying to find your network in that new state and not quite sure of where you belong.
Yeah.
So we work with people who have significant mental health issues, but we also work with people who are just trying to manage whatever transition has happened in their lives.
I'm so glad you said that, because I think there's still, and that's part of the stigma, only people who have this sort of issue go, for mental health treatment. But it really can be about life transitions, and really, you can go into therapy. I shouldn't say for anything, but really for anything.
Really, I mean, think about some of the younger students. Sometimes they just want to learn how to do goal setting and how to, they're going into like high school from middle school.
Yeah.
And they just want to know how to do goal setting, maybe how to learn some social skills. And, or some people have ADHD and they just want to learn, how do I manage having ADHD not on medications, right? Without the medication. So there are many people who developmentally can help them with that and with other things. It doesn't have to be something as big as a schizophrenia or any other psychosis or even PTSD.
Yeah, and some people think that, like, that's why you go see a therapist.
And some people don't even have depression or anxiety.
Right.
They really just have some challenges that they with adjustment.
Right.
They're adjusting to something, right?
That's good. That's good. So I hope you guys can play that back what Dr. Price was saying in terms of reasons to go to therapy. It doesn't have to be the most extreme mental health situation. It could just be a matter of adjusting to your life. So go if you feel like you need to go. Okay. All right. Let's see. So barriers. Okay, postpartum. This is something that affects women uniquely. What are some signs?
Back to those hormones.
Yes, definitely. What are signs and symptoms? I mean, because a lot of times, that is something that does get talked about in the news quite a bit, and some people might want a little bit more clarity on postpartum depression, what it is and what it's not. Like, because I think we should contrast that between, maybe
baby blues and So with postpartum depression, it is a more extreme version of baby blues. So baby blues is something that most women experience after having a baby. And you and I have had babies, so we probably experienced it, but we moved through it. And for most women, they will move through this within a week or two. And with baby blues, you're dealing with being a new parent.
Exactly.
And it could be your second child, your first, or it could be your fifth, but still you're dealing with being a new parent. You're also trying to manage the needs of a new child and what this child will need from you.
Right.
Because they don't come with a book.
Nope.
And you can
all.
read all the books you want, and I've read books. I know you read books because we're that kind. So that particular child doesn't come with a book. So in the beginning, you're trying to figure this baby out. So in doing that, oftentimes we are depriving ourselves of some of the things that we need, which is sleep, proper nutrition, and just a routine, right? So because we're trying to get this child into, we're trying to learn the child and get the child into a comfortable routine for the child, often our needs are neglected.
Right.
So there are a lot of women who are just exhausted. And so you see more tearfulness. You see more emotion. You see more nervousness. There are a lot of women that feel very nervous in holding their baby because maybe this is a new baby for them. You know, I mean, they're all new babies, but this is, parenthood is new for them.
That's right.
And they're not quite sure how to hold the baby right, and they want to, you love this little being more than anything in the world, and you want to get it right.
That's right.
And we put a lot of pressure on ourselves as women
That's
to
right.
get it right. And we believe that because we're women and we're nurturers and we're all these, things, particularly that the society says, and some of it we really are. We're biologically made that way. So we put pressure on ourselves to get it right. And then we feel like maybe we're not getting it right. Maybe we gave the child something and they spit it up. And we said, oh my gosh, I should have known better than to give them this or that. So we put a lot of pressure on ourselves. So there's a very emotional thing that's going on within particularly those first 2 weeks. And it's just adjusting.
Yeah.
Like we talked about before, adjusting to a new transition. That's expected. Now we have postpartum. With postpartum depression, we see a lot of sadness. We see a lot of self-doubt, self-blame. We see a woman's inability to connect with her newborn. Now, oftentimes that inability to connect has a lot to do with the fear and wanting to get it right, right? And on this side with postpartum, we're feeling like we're not getting it right. So I can't serve this child. I'm not doing right by this child. So it's hard for me to connect because I don't want to hurt this child. Or there are some women who feel kind of, there's a lot of emotion. Sometimes it's anger. That their lives have changed so much to accommodate this child. That their bodies have changed so much to accommodate this child or because this child is here. So we see very extremes. There are some people who can be so disconnected from themselves and sometimes their own emotions that they think about self-harm. And so we see that as well with women with postpartum depression. Now, women who have a support network will often fare better and will often move through those difficulties, whether it's baby blues or PTSD or postpartum depression. They will often move through those cycles a little easier than women who may not have the same level of support.
And what do those supports look like?
They can either be a spouse or parents or even a strong fellowship of church community. It can be sisters, brothers, a sibling. It can be anyone. Those that level of support.
Also, I know there are moms groups too that can be helpful. In your community. I know some hospitals sponsor them. I think the state of Maryland does have something like that. I can put on the website later the website information for that. I don't have it on the top of my head.
Yes. I think that would be really helpful.
That could be helpful to folks as well. But also what the primary support group that you're mentioning, the spouses, the grandparents, so important. So,
and for some women who have mental health issues prior to the pregnancy, we can almost anticipate that the additional stressor of a new baby is going to exacerbate whatever it was that they were experiencing already.
So true. So true. And so it's important to know that, right? And, it's often helpful, if you're already in some sort of, treatment prior to having the baby, you can be proactive about, about that, what to have in place. I know there are some antidepressants that are safe for women to take while they're nursing.
Absolutely.
If medication is warranted for certain things.
And with the women that I have in my practice who are pregnant, who are already, I mean, we're just working through anxiety or depression particularly, I try and help with expectations.
Oh, that's a big one.
Expectations of themselves as new parents or as a parent. Expectations of whoever the primary support people are in their lives, and expectations of the child. Right?
Wow,
because when you're a new mother, I remember when I was a new mother 13 years ago, I thought this little human was going to bend to my will. Right? He was going to do whatever it is that I needed him to do, because, you know, he was just going to do that. He did none of what I wanted him to do. He did not have a regular bedtime. He did not eat as much as I wanted him or eat as less as. It was a whole other experience.
Yeah.
But I had a primary support people around me, and I was active duty in the Army, but the wives of many of I was an officer, of the officers, they were there and they were helping and they were telling me, hey, when little Johnny came home, he too didn't latch. Or when little Rebecca came, she had a hard time sleeping at night.
Wow.
So then I knew it wasn't just that I didn't know what I was doing. I mean, it was clear I didn't know what I was doing. But they helped in that too. And then my mom was there as well.
Wow.
And she said, hey, these are the things that are reasonable to expect. So she helped me with expectations.
Wow.
So I try and do that in my practice. I try and help women with what to expect. You know that book, What to Expect When You're Expecting?
Yeah.
I didn't find it that helpful, but I do find those women who have been through it, and they can help you, and they know you, right? What to expect when you're expecting. It generalizes in a sense. I mean, it's fine, but we have different temperaments as women, right?
That's right.
So some of the things that are in there may or may not apply to us. But when someone who loves you, like your mom or mother-in-law, whomever, or cousin, when they tell you things, they're also basing this on what they know about how you operate and what works for you.
Wow.
So that is so, it's just, so I try to encourage them, like, you know, who can be around you, who can help you in this process. So, you know, there's usually a significant other. So is there a mom? Is there a mother-in-law? Are there other people? Even your church community, is there somebody that you're close to? Is there a sister or somebody who loves you and knows you and maybe have had a baby themselves, can help you to understand some things and have the patience? Because it requires so much patience while the new mom, is just trying to make sense out of everything about her life that has just changed.
Yep. Wow, some really good helpful information that I hope, you know, will be helpful to our viewers. So I think we covered postpartum, you know, sort of what postpartum looks like and what the baby blues looks like, and how postpartum is, you know, more extreme.
And lasts longer.
The duration. So that's the difference, the duration.
And so I think one of the things is for women who are already in treatment for depression, anxiety, or whatever you're in treatment for, and also become pregnant, you might want to just be mindful of those things, that the hormones and just the stress of having a new baby can impact you in some significant ways, and to please talk to your healthcare provider or whomever it is that you are speaking with about your emotional health. Speak to them about what you can, you know, about how you're feeling bringing this new baby in, or the prospect, and start looking and working on expectations as well.
That's so good. Yeah, like, I mean, being proactive and really trying to put those things in place ahead of time. So I think that's really, really good and helpful. Okay. Let's see. Okay, so I know that you're probably not taking new clients, but can you tell our viewers how to reach out? Well, before we do that, I didn't ask you how you came up with Women's Inner Fitness. I love the name, by the way.
Thank you.
I love it so much. I called this segment Women's Inner Fitness. So what were you thinking when you decided to call the practice Women's Inner Fitness?
I was thinking about women and the totality of who we are, and I see us multidimensional. And so our emotional health and wellness and well-being is a part of that, but it also is our spirituality, and it also is our nutrition. It's about our relationships. It's about all these things that help affect and impact us in such a profound way. So when I thought of inner fitness, I didn't want to say mental health, because it's not just that.
Right.
It's all those different things that I just mentioned.
Wow.
So it's the fitness of all of it, and
Wow.
it happens in here.
Wow.
So
Inside.
that's how I came up with inner fitness,
Wow.
because I want people to, when they come, that they know it's going to be a total experience.
Wow.
I'm going to talk about what your mental health issues are, but I'm also going to ask you about what you eat. I'm
Wow.
also going to ask you about what's your, your spiritual life, what is that like?
Wow.
And who are the connections and your primary support people?
Wow.
So I'm looking at you from a very holistic
yeah.
point.
I was just about to say that. Is that how you practice? I mean, I think it's probably best to practice that way, more of like a holistic, integrative sort
Absolutely,
of
yes.
way of working.
Yes. So I try to connect people with yoga. Insight Timer is free, and they have guided meditations, as well as they have just sound meditations.
Is that an app?
It's an app.
What's it called again?
Insight Timer.
Insight Timer.
Yes. It's a free app, and
Free.
yes, I love it. And they have so many different soundtracks on Insight Timer that we can access at any time.
Wow.
And use for either meditation or just reframing our cognitions about things. For people who are struggling with insomnia, there are different tracks to help you with sleep. Some are sound waves,
Mm-hmm.
some are nature sounds,
Wow.
and some is just a person kind of talking you through the levels of sleep.
Wow. that
So
sounds good.
Insight Timer has so many different ways that they can help support a person.
Mhm.
And so I tell people about the meditation, prayers, through Insight Timer, and through personal connections, and exercise, eating, just all of it.
All of it, guys.
Yes.
It all makes a difference.
Yes,
and,
it does.
It's all supposed to work together.
Mhm.
I think that's how we were designed, for it to all work together.
I think that's, and I think that we're made that way. Yes.
Yeah. So, all right. So, can you tell our viewers how to reach out to you for more information or to set an appointment? Now, I don't think you might be accepting new clients, but if you are, please share. I know you have several clinicians that work with you, though.
Yes. I have 6 other clinicians. So, yeah, I am primarily focused on the veterans and cancer population. That's my primary population. And so getting an appointment with me is difficult right now because of the administrative work, and then the work that I'm doing with Breast Care for Washington, which is very near and dear to my heart, and I really want to see all those programs grow. But to reach out to my office, they can either go to my website, which is womensinnerfitness.com, or they can call the office at 443-569-8882. So you can reach us through the website, or you can call our office. The website has all of the clinicians' bios and helps you to get a sense of who you may feel would be the best fit for you. But when you call our office, we will certainly, the scheduler will ask you just about some of your preferences and what you might be looking for in counseling. And we'll also help to guide you towards the therapist, the clinician, who will probably be a very good fit for you.
Thank you. So, Dr. Price, is there anyone else in your practice that does a specialization with cancer women who have cancer diagnosis, or? Okay.
So we do have 2 other clinicians who work with women with chronic illnesses,
Okay.
cancer, and autoimmune, and that would be Dr. Monique Oglesby
Okay.
and Miss Angela Wilbon. And she's a social worker, and she's about to finish her PhD at Howard University. So I'm so excited for her.
Shout out!
Yes, but she is. Those 2 individuals also work with people who have chronic illnesses, and the entire practice has been trained on how to work with veterans.
Okay.
And I will continue to do more work with my clinicians on working with the veteran population, as well as women who have been diagnosed with chronic illnesses, so that a person who is wanting to get services can feel supported by any of us, and I think that's really important.
That's wonderful, because I can imagine that, you know, people after this, after I rerun this this hour of breakthrough, I can imagine that there would be people out there who would want to get connected with services, you know, specifically with, you know, maybe that concern. So I think it's great that there are several providers that, you know, would be available potentially to see individuals. So I think it's great.
Yeah, thank you.
Yay! Thank you.
I can't believe it's been an hour.
I know. It literally. I think this is the first hour breakthrough that was actually an hour. Well, I think I had another one, but yeah. Okay. I appreciate it, Dr. Price. It has been awesome privilege and pleasure to have you on.
Well, thank you so much for inviting me, and I'm always happy to talk about women's mental health and how women can support other women.
Yes.
I think that's important.
Yep. I'm definitely down for that. You know, I think it's important that we support each other, even in the field of mental health.
Yes.
And, you know, just our communities. I think we have a knowledge base that can be very helpful to individuals in the community. And so I'm glad that we're both able to take the time to do this. I really appreciate you taking your time to do this.
Well,
I know you had
for
clients today. So thank you so much.
Yeah, thank you.
All right, take care. You guys will be able to see this again later. I'll rerun it. Okay, take care. Bye-bye.
Bye.